CEN Test Prep Exam High School. Question 1. The most common cause of acute renal failure in hospitalized patients is Option A. Glomerulonephritis. Option B. Acute tubular necrosis. Option C. Renal calculi. Option D. Pyelonephritis. The correct answer is option B. Acute tubular necrosis. Question 2. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is Option A. Absent breath sounds. Option B. A dullness to percussion on the affected side. Option C. A tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Dullness to percussion on the affected side. Question 3. The safe harbor provision for nurses typically refers to Option A. A law that provides legal immunity in all circumstances. Option B. A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C. A hospital policy allowing nurses to refuse any assignment. Option D. The requirement to report all medication errors. The correct answer is option B. A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. The antidote for benzodiazepine overdose is Option A. Naloxone. Option B. Flumazenol. Option C. N-acetylcysteine. Option D. Atropine. The correct answer is option B. Flumazenol. Question 5. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A. Confront the colleague directly. Option B. Report the observation to the charge nurse or manager immediately. Option C. Document the observation in the patient's chart. Option D. Call the police. The correct answer is option B. Report the observation to the charge nurse or manager immediately. Question 6. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A. Tachycardia. Option B. Narrowed pulse pressure. Option C. Hypotension. Option D. Tachypnea. The correct answer is option C. Hypotension. Question 7. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is Option A. Forcing oral fluids. Option B. Straining all urine. Option C. Pain management. Option D. Surgical consultation. The correct answer is option C. Pain management. Question 8. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as Option A. Gray-Turner's sign. Option B. Cullen's sign. Option C. Murphy's sign. Option D. Rovsing's sign. The correct answer is option B. Cullen's sign. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. What is the classic sign of a basilar skull fracture? Option A. Battle's sign, mastoid ecchymosis. Option B. Rhinorrhea with glucose minus negative fluid. Option C. Hemotympanum. Option D. All of the above. The correct answer is option D. All of the above. Question 10. The purpose of administering surfactant to a patient with ARDS is to Option A. Bronchodilate the airways. Option B. Reduce alveolar surface tension and prevent atelectasis. Option C. Decrease pulmonary capillary permeability. Option D. Increase mucociliary clearance. The correct answer is option B. Reduce alveolar surface tension and prevent atelectasis. Question 11. A patient experiencing a tonic-minus-clonic seizure is in the emergency department. What is the priority intervention? Option A. Restrain the patient firmly. Option B, insert a bite block. Option C, maintain airway and administer benzodiazepines as ordered. Option D, obtain a stat CT scan. The correct answer is option C. Maintain airway and administer benzodiazepines as ordered. Question 12. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates option A, allergic rhinitis. Option B, nasal mucosal secretions. Option C, CSF leak, rhinorrhea. Option D, sinus infection. The correct answer is option C. CSF leak, rhinorrhea. Question 13. Murphy's sign is used to assess for option A, pancreatitis. Option B, acute cholecystitis. Option C, diverticulitis. Option D, small bowel obstruction. The correct answer is option B, acute cholecystitis. Question 14. Testicular torsion is a surgical emergency that requires intervention within option A, 24 hours. Option B, 4-6 hours. Option C, 2-3 days. Option D, it is not a surgical emergency. The correct answer is option B, 4-6 hours. Question 15. A patient receiving intravenous nitroglycerin for chest pain develops severe headache. The nurse should option A, stop the nitroglycerin infusion immediately. Option B, administer morphine for the headache. Option C, treat the headache and continue nitroglycerin as ordered. Option D, switch to oral nitrates. The correct answer is option C, treat the headache and continue nitroglycerin as ordered. Question 16. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. Question 17. To calculate cerebral perfusion pressure, CPP, the nurse needs to know option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 18. A Call's fracture involves the option A, proximal humerus. Option B, distal radius. Option C, femoral neck. Option D, tibial plateau. The correct answer is option B, distal radius. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Carbon monoxide poisoning leads to hypoxia primarily by option A, causing bronchospasm. Option B, binding to hemoglobin with higher affinity than oxygen. Option C, destroying lung parenchyma. Option D, causing pulmonary edema. The correct answer is option B, binding to hemoglobin with higher affinity than oxygen. Question 20. A patient with an acute myocardial infarction develops a new holosystolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A, a ventricular septal rupture. Option B, papillary muscle rupture with mitral regurgitation. Option C, pericarditis. Option D, aortic dissection. The correct answer is option B, papillary muscle rupture with mitral regurgitation. Question 21. Sengstaken Blakemore tube placement is used as a temporizing measure for bleeding from option A, peptic ulcer. Option B, esophageal varices. Option C, diverticulosis. Option D, aortoenteric fistula. The correct answer is option B, esophageal varices. Question 22. The most effective method to control severe bleeding from an extremity wound is option A, elevation. Option B, direct pressure. Option C, pressure point compression. Option D, ice application. The correct answer is option B, Direct pressure. Question 23. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is option A. Obtain a stat chest X-ray. Option B. A needle decompression at the right second intercostal space. Option C. Administer albuterol nebulizer. Option D. Prepare for intubation. The correct answer is option B. Needle decompression at the right second intercostal space. Question 24. Which assessment finding is consistent with a flail chest? Option A. A crepitus over the sternum. Option B. Paradoxical chest wall movement. Option C. A tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Paradoxical chest wall movement. Question 25. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates option A. A damage above the midbrain. Option B. A damage at or below the midbrain/brainstem. Option C. Damage to the cerebral cortex. Option D. A positive outcome. The correct answer is option B. Damage at or below the midbrain/brainstem.